Good afternoon, good day, good morning, good whatever is in your day today. My name is Chuck Gillespie. I am the CEO of the National Wellness Institute. I am in my fourth year here at NWI, and I'm so lucky because I get to work with some of the most amazing people on the planet, including our wonderful members of the National Wellness Institute, our staff, our board of directors, our board of advisors, our senior fellows, and everybody else that I get to kind of have comment and connections to. We started the Reimagining Wellness Live Conversations, like I said, back in March of 2020 when COVID was just hitting. One of the things we were trying to do at that exact moment was attempt to figure out how we could get rid of the word social distancing, because that wasn't the right terminology. We wanted to make it physical distancing. And so we were trying to go with being socially connected while being physically distancing. And that was really our initial conversations of everything we were doing with this. But I can still remember the very first one, I was teaching people how to use Zoom. So we were looking at things like backgrounds and how to actually, use the chats and so forth. But what it did was it really made us pretty good at this stuff. And again, my cohort and partner in crime here, Lana Saul, as our chief chatterator, has been also exceptionally helpful in kind of making all these things happen. But we got a lot of response back and said, hey, let's get these things started again. So here we go. And I am so excited simply because of the person that we get to start this brand new programs off with is Dr. Richard Safier. Rich is with the Johns Hopkins University School. Are you with the school or are you with just the university?
Well, my paycheck comes from the health system, and I have a faculty appointment in the School of Medicine and the School of Public Health.
So, you're busy, what you're saying.
A little bit, but never too busy to speak to my good friend, Chuck.
Well, and what's great is Rich and I really got to know each other recently because of the book that he's got out. And we'll talk a little bit about that, obviously, today. But what was really, really fun was I got to actually do a pre-read of the book. And I'm going to tell you guys, as I was telling Rich before we all got on, I go into books like that with a lot of skepticism just because of, what we do for a living. I was so pleased with the book that Rich had built and developed and programmed. And what he's telling me is even after I've done the pre-read, the newest version that he's going to be sending to me, and then I got to find him so he can sign it for me, because those are the ones that make money on eBay. Sorry, Rich, I had to make the
That's comment. Okay. It's okay.
So I'm really excited about reading it for the second time and looking forward to it. So, Rich, tell us about yourself.
Well, thanks for having me, Chuck. It's nice to be socially connected, even if we're physically distant. So I live in Maryland with my wife and our youngest daughter who's in high school. I've got two older boys who are in college, and we have a dog. I am fortunate to be serving the 42,000 employees at Johns Hopkins, and also fortunate to be able to exercise and get outside most days. I like the great outdoors, and I could go on, but that's just a little sample for you.
That is awesome. So what sparked you to write the book?
Well, like probably most of us here today, we had a little extra time to think about things during the pandemic and think about things differently during the pandemic. And I had been keeping a journal about my time at Hopkins, a lot of interesting stories, a lot of interesting twists and turns along the way, and decided, hey, I'm getting close to the end of my career. It's probably time to write this book. I think there's a lot of things that I can offer other people who are not just in our field, but also leaders, managers, and human resource professionals.
And it's so true. And it really is back to, what do you feel like you have learned that people really need to, I'll say it this way, I've got 30 plus years in my career already. I'm 54, getting ready to be 55 in April. And there's a lot of things.
I'll let you into the 55 club.
There you go. But the thing I get excited about, Rich, is when I get a chance to speak with the emerging professionals, those folks that are just getting their lives started, their careers started, and say, for God's sakes, don't do this. For God's sakes, don't do that. What are some of the things that you feel like after writing the book and after everything you're doing, what would say the 1, 2, or 3 things that you've constantly been telling people, especially moving into these careers? What are those things that you like to say, don't do this, or, think about it this way?
Well, let me just share with you what I find one of the biggest challenges is that for most organizations, you've got a person or a team of people who are really committed to supporting the health and well-being of the workforce. And yet we know we can't do it alone, right? None of us can lift the weight of the world on our shoulders. And so I've always wished that I'd have more managers, more leaders, more HR partners who are not only interested, but actually engaged in the process, like real partners. And I'm guessing that many of you have felt the same. And so one of the things that I learned from this book, and one of the things I set out to do, was to create a book where it was a good vehicle for the practitioners as well as our partners in HR and the leadership. So one thing I would say that I learned, which many of you already know, is, hey, we need to get our leaders on board. But I would go one step further. Most people who get their MBA or get a promotion and become a manager, a team leader, they don't get trained on how to lead with well-being. It's almost like it's not even a conversation. They get trained on how to do the payroll and the whatever else, but not well-being. It took me 3 years to get our first leadership training program around well-being. While I was at Hopkins, it happened around 4 years ago, 5 years, and now we have 4 different training programs, and I feel really good about that. So the second thing, Chuck, then is to give your leadership some support. Don't just expect them to know what they're doing.
Okay, so I have to ask then.
Yeah.
You're a large university-based system.
Yeah.
It's got those leadership training programs have to have a good acronym, right?
Oh, well, we have an LMS, learning management system. I don't know if that's a good acronym. I don't have anything creative.
See, one of the best programs that I ever went through in my leadership training world was a program with the Rural Electric leadership. It was Rural Electric cooperatives. I worked in the Rural Electric world. I was the HR person for them. And they had the Rural Electric Leadership and Training Exchange, or Relight.
Okay.
So I always like to hear about fun little Linda's Linder going, yeah, that's a good one. But those are some of the fun things that we're really talking about, is how, so when we think about leadership, and again, I remember it in your book, define leadership to everybody here, because I like the way you define it, because you don't necessarily define it as C-suite.
Oh, yeah, no. Anybody who has an opportunity to influence the health and well-being of their team or their workforce is a leader. You don't even have to have people who report to you to be a leader. And we know that when more people participate in creating a well-being culture in the workplace, that workplace is much more likely to support health and well-being. So I do define leadership pretty broadly.
And it's so important to have that broader definition, because sometimes when we use terms like leadership, that gets lost in what we're talking about. And when we're talking about, that's why I like how you defined it, because for us, for the wellness professional, for the sake of well-being, we've really got to understand that we've got to be that well leader. And when we talk about a well leader, it really is looking at it from the who are we that can help us function optimally, and then what are the environmental opportunities that we can change to reflect that, so that we can help influence the health and well-being of all those around us and those that we are representing. It's such an important piece. And Rich, talk about some of the things that you've seen change at Johns Hopkins, and maybe even some of the other areas and work that you've done in the past.
Yeah, so I've been at Hopkins for 11 years. I was at 4 other employers prior to that. So I'm pushing past 25 years now in this space. And the question was about Hopkins, but I would just say that the changes that we've made at Hopkins is the result of me having mixed success beforehand, right? We all learn from our mistakes. And I think after 15 years and then getting to Hopkins, I think they benefited from me getting a lot of those mistakes out of the way. So one of the big changes that occurred and helped really accelerate our change is that well-being is now part of the annual goals for the institution. We have a set of strategic objectives that come out every year, and well-being has been amongst those strategic objectives for the last 8 or 9 years now. And so I really am very grateful that that the pitch that we gave 9 years ago worked, and I'm grateful that we've delivered, because when you get those kind of opportunities, you really want to make sure they succeed, because you may not get that chance again.
How long did that evolution take you?
Well,
in that 9-year period of time, especially.
Well, the evolution to get the strategic well-being as part of the strategic objective came within 18 months, and then it was probably another 6 months before the year started. But to get the audience to actually pitch the idea, that I want to tell a story, okay?
That's fine.
So when I got to Hopkins, there really was no position. Like now I'm the Chief Medical Director of Employee Health and Wellbeing. There was no position that supported employee health and wellbeing full-time. And so what I needed to do was to try to get some other like-minded people together and cause a change. And we did that by changing the soda environment. And fast forward to say that eventually the president of the health system said, hey, I want to know what's happening because changes were happening on the ground. And we really made changes without the heads of the organization. So that's what got me the audience. Sometimes we have to take calculated risks that aren't going to endanger anybody, and make a little splash. And then when somebody gets wet because you made a splash, then you're going to get an audience with the president.
But that's the whole point we're looking at. And I think this is something that we as wellness and well-being professionals really have to fight is, so much of, especially the upper echelon, the executive leadership, thinks in quarterly statements.
Yeah.
Wellness, well-being, whatever we're talking about here, it's a marathon. It is a multi-year evolution that has to be built upon each and everything that you've done. And you've got to sometimes, one of my favorite stories is, talking about sometimes you got to start with something that may not necessarily be what is needed, but it's what people are willing to do and ready to do.
Yeah.
And then you've got those. Now you've got some success points that you can start to point to, and then that helps not only that the slapping of the wrist of sodas, so to speak, to the president got you the audience, but now all of a sudden, how do you keep that audience and move it forward? And it's that slow evolutionary piece and reminders of what's going on.
I always say it is a marathon, not a sprint. And I didn't get my wrist slapped. It's just that I created some like buzz. And it wasn't a caffeine buzz either. It was a buzz like, what's going on here? We're changing stuff. I do think it's, for some people who are with us today, if you're just getting started, then, you're still trying to find your first impression. For those of you who've been at it in the organization you're with now, it doesn't mean that you can't make a first impression again. If things aren't working the way you want them to, you could take a step back and reimagine wellness. You like how I slipped that in, Chuck?
I love it. Thank you.
It wasn't even scripted. I swear to God. You could reimagine wellness and pick something that you think is going to make a splash. And I can't tell you the number of times where I've just had to either take a walk by myself or go swimming and just spend time thinking, like, how am I going to break through on this? And fortunately, I've been able to do that a number of times now.
That's awesome. Sue Murphy's got a great question for you. What type of metrics has the C-suite leadership needed to see in order to put well-being on the strategic map?
So we measure a lot of stuff, and I won't go through all of them, but what I will say is the measurement that got us moving faster and accelerating, the one that I pitched to the president of the health system, was an organizational assessment tool. Now that was the answer, but to get to that answer, I needed to provide him with 4 choices. He didn't say come back with 4 choices, but the way I like to do things, I like to give leaders choices, but I also like to kind of direct them towards what I think is. So Mr. Peterson came up in the finance arm of Johns Hopkins Medicine. So I was pretty sure I couldn't ignore that. So when I walked into the meeting, Chuck, I first said, hey, I'm going to give you 4 different ways that we could possibly measure this. The first way is finance, but it's also the way that I think that we should not go. And here's why. I chose to not ignore it. I knew it was on his mind, and it worked out. Now, for us, the reason why the CDC Worksite Health Scorecard worked for Johns Hopkins Medicine are several things. One, we're an academic institution, and it is based on science. And so that's a good connection. Number 2, it is free. I didn't have to ask for money. Number 3, we did not require any IT resources, which made it great because there again, I'm not asking for anything other than your permission. And number 4, the scorecard comes with benchmarks for other healthcare organizations and other large employers. So for me to recommend, there were several reasons for me to recommend that path. And I think that for each of you, you each face different audiences. You will need to find the measurement that you think resonates with your audience. Maybe not you as much as your audience. And then later on, after you've pulled them in, then you can start thinking about, okay, now what would I think might be more meaningful to me?
And Lynn and Hopeful, I hope that answered your questions as well, because they were very similar in nature to the metrics question. You know, Rich, one of the things that I remember when I was working with an organization, and it was actually an alcohol distribution company, and the CEO at the time, who has become a friend over the years, I remember his comment was, he goes, Chuck, I can't tell you how many times I said no. In fact, I said no in so many different ways, including cuss words, that I was expecting that this would never come back. But then they came up with a proposition that I couldn't refuse.
Yeah.
And in this particular case, they were able to showcase that they could actually add a wellness center inside of the distribution center for the same price that it was costing them to send out their truck drivers and drivers to get their CDL
yes,
safety,
the certified driver's license.
Well, and their yearly screens to keep and maintain that CDL. So he goes, the 2 greatest words you can say to a CEO is budget reallocation.
Yeah.
And so that's another way of kind of looking at the same thing.
Oh, absolutely. And more than twice, we used, I made the case about covering the cost of something by showing a direct reduction in costs in another area. And that I find to be much more effective than return on investment. But to say, hey, this isn't going to cost you any money. This is how it's going to be budget neutral. And these are the benefits that you're going to get out of it.
Yeah, I've used the term impact as over ROI, VOI, because I've always, and again, I think many of you might have even heard me say this before. In order to get a return on investment, you have to have an investment.
Yeah.
And the whole idea of wellness is to not have to invest to begin with. So we've really got to talk about things like avoided costs, not necessarily, that type of piece. Kate, great question. Once you got leaders on board, what did the program offer to support, encourage more employees to take part in the program to actually impact the culture as a whole?
So going back 8, 9 years, it wasn't really a program that we were pitching. We were really pitching a change in the workplace, a change in the environment to get us out of the gate. And so, yes, the sodas were the main thing that we were addressing at the time, but shortly thereafter, we addressed the nutrition environment, the tobacco environment, all of the usual suspects. We eventually we knew that we were on a path to be very intentional to create a culture of well-being in the workplace. And along the way, we added programs, but those programs were only added after we knew that we had the support structure in place, so that once we had the programs, one, they'd be more likely to be used, and two, once they were used, the participants would be supported with what they were learning during the program. So we have like all kinds of programs. So I don't know if you want to get more specific, but if you have a health issue, title, what have you, I'm pretty sure we have the resources, but that's not our strength. Our strength is that we've created a culture in the workplace where people can feel supported on their individual journey.
And again, Rich, it goes back to your book. See, it was a good thing I read your book. What it was something that it was always in my head, but the way you described it in the book really helped me think about it. The C-suite, the leadership, the thing that they have the most control over is the environment, the culture that we are working in and performing in. There's not as much control and strength in individual health. You can tell somebody to quit smoking all day long. If they want to keep smoking, they're going to. But if you create a no smoking environment, now they're going to have a lot more trouble smoking. Talk about those kind of opportunities that you've seen that we could really, even some short steps and maybe some long-term steps that we could take from this.
Sure. I mean, I think most of the folks with us today, Chuck, are familiar with making the healthiest choice the easiest choice. And so we've done that at a number of different levels. What I focus mostly on in the book is creating the circumstances at work where, regardless of what health journey you're on, whether it's physical health, emotional health, social health, I mean, you name it, the leaders, the managers, the human resource folks, and the people on the health promotion team are all rowing in the same direction. We're all creating the same conditions. And so instead of speaking like philosophically up here, let me just give a couple of examples. Peer support. If you've seen me post on LinkedIn, then you've seen me post on peer support. The support we get from our coworkers, our team, is critical in how we go through the day. And so I think that many employers don't give that a thought, and they just kind of like, yeah, you want to go have friends, go have friends. But we can be intentional as strategists in health promotion and members of NWI. We can be intentional in setting up situations where it's easy for coworkers to work together. Just look at onboarding. Why not make sure that your new employees either have a buddy who's also a new employee, and then they can share the same stress, the same joy of having a new job, or team them up with a veteran so that they have someone to ask questions and help them navigate. I could go on with a lot of different examples, Chuck, but hopefully I've made my point.
Yeah, I did, and hopefully, Neha, that actually kind of helped answer your question about examples of supporting employees on their well-being journey. So I loved it because it really is exactly what it is. It's understanding who your employees listen to the most in the workplace, who your people who your people work not even at work, but even in the communities. Who are they listening to?
Yeah.
And that's really what we've got to understand.
Yeah. I like to joke that we all know we're supposed to eat an apple a day to keep the doctor away. But wouldn't it be easier if someone on your team brought in like a bowl of apples instead of like a plate of donuts? Or I mean, the list goes on and on. I mean, I think education's important, but it's also, I think most people know they're not supposed to smoke.
Yeah. One of my favorites was, the ever famous, birthday of the month sheet cake.
Yeah.
And what we actually had a company we did some consulting with, and one of the best things that we talked about was cut the sheet cake in half.
Yeah.
And use that money, budget reallocation, to bring in some fruit and vegetables. At least try it once and see what happens.
Yep.
Guess what? That next month, all the fruit and vegetables were gone. They still had half a cake left.
Yeah.
They cut the sheet cake in half again, brought more fruits and vegetables in, and the next thing you know, sometimes we think that's what people want. They want donuts. Yeah, donuts go fast. I'm not going to lie.
Yeah.
But you'd be surprised that so does the fruit and vegetable.
Yeah.
Mainly the fruit. Maybe not. Not a lot of people like their morning carrot, but that's it keeps you away. Oh no, that's the apple that keeps you away. The doctor. That's right. So there's my other dad joke for the day. Sorry, folks.
We got one more waiting for us before the end of the hour.
I got at least one more before the end.
That's right. 3 strikes.
Good question here. Don't know who it was from, so I apologize. There's a lot of attention given to physical health in this wellness space, but not as much to mental health. What are some of the things you're seeing? And obviously we're seeing a lot more conversations in the mental health side today, but what are some of the evaluation methods that you have used to determine the interventions and which of these mental health programs are actually working?
Yeah, I mean, we're seeing appropriately, we're seeing a lot more about mental health in the workplace. Even just the recent Surgeon General's report. Well, I've seen the entire spectrum of opportunities, from outsourcing to EAPs to insourcing to organizing employee resource groups where employees of similar background can get together and be peers and support each other, because they're the thing that brought them together that's in common is something that's bothering them. As far as measurement's concerned, this also runs the spectrum. We certainly could be measuring participation or utilization of resources. I actually think that's important, not as a measurement of success, but rather a measurement of whether or not you should continue to fund that resource. Because if people aren't using it, then what's the point? But participation has limited, as we all know, it's limited in telling us, well, did it make a difference? Measurement on the other side of utilization and whether or not something is effective is in the eye of the beholder. And so if we ask our employees to fill out a survey, like, what is your opinion about, does your manager care about your health and well-being? I can't argue with their answers. I can't tell them that, no, that can't be right. I'm sure he or she cares about you. So we actually do have a culture of health survey that we put out every year, asking our employees for opinions about how they see the well-being culture around them. We do ask them, is your manager a role model of well-being? Do you find that your manager helps remove barriers so that you can have a healthier day? And those things impact our health and well-being and our mental health. We do have a health risk assessment. I'm not going to say it's like the best health risk assessment in the world. I am going to say that we continue to provide it voluntarily, of course, because we do get data about the degree of stress and the number of people who are saying they're having different symptoms of depression, things that we may not get from our health plan claims. So Chuck, we get a lot of different mental health related data.
And that's the beauty of being a large academic healthcare system. It's not something that everybody can handle. And believe me, I know enough organizations, even large, multi-billion-dollar organizations, that can't handle how to understand how to use biometric screens, let alone all the other data. But that's just something we all have to be able to kind of handle and do. And by the way, that question was from Tara. So thank you so much, Tara, for that question.
Thank you, Tara.
Linda, you've hit a perfect, one of my favorite spaces as well. Rich, how have you collaborated with like OSHA and safety and the safety departments at Johns?
Yeah, well, first, hats off to every OSHA and OC Health department over the past 2.5 years.
Amen.
Yeah, yes. Prior to the pandemic, we did a number, we had a collaborative network in the sense that they knew what the resources were that are available to our workforce at large. And so they had all the information available to either hand a piece of paper or actually do an electronic referral to, let's say, a disease management type program. They also provide blood pressure screening. So one of our big chronic disease areas that we spend time on is blood pressure. And so they've been a partner on that path. I can't say that, we partner with just about every department who's willing to partner. And so that's just one example of a productive relationship.
I will say, a couple of different consulting jobs that I have done, in manufacturing, in utilities, those two in particular. There have been more than one time when I've introduced the wellness leads to the safety departments, because the safety departments were asking me literally questions like, how do I make sure that my people are happy and healthy?
Yeah,
like,
wow.
And I'm like, you got a wellness department? We do?
Yeah.
So
yeah.
it's an important piece. And I love the fact that and I also loved your comment of, we want to team up with every department that wants to team up with us.
Oh yeah, this is the same theme, Chuck. We cannot do this work alone. And in chapter 1 of the book, you might recall, I call out a little section, who are our partners, and OC Health is in there.
Yeah, big time. And it's such an important part of everything that we talk about and do. As a matter of fact, another one of my favorites, manufacturing firm that I worked with, I swear to God, this was the easiest consulting money I ever made. I walked in, I was in the front lobby, and the wellness lead comes out to me, and she's like, Chuck, all my company wants to do is talk safety, safety, safety. And it's really embedded, it's really hurting everything that we're trying to do from a wellness program. What should I do? And I looked at her and go, call it a safety program. And she looked at me like I had just invented sliced bread, because she didn't even think about it that way. And it's like, again, we go back to it. I put out a recent one, wellness or well-being. Which one is it? Is it interchangeable? And Rich, I loved your reply, by the way, to that one. But the point you look at, guys, is we got to get out of this mindset that we have to call it something. We need to activate it. We need to move it forward. I don't care if you call it a safety program, wellness, well-being, professional development, population health, call it an Indiana Hoosier for all I care. I'm all about just activating that and really moving it forward.
Yeah, now you got me, you got my creative juices going. So I thank you for mentioning A Cure for the Common Company, the name of my book, but I'm going to give a shout out to another book called Made to Stick by the Heath brothers. And if messaging is so important for us, if your message isn't coming across, it's time to change the message. And the Heath brothers wrote Made to Stick, and it's all about the formula to create an effective message. We spend quite a bit of time, even just crafting our subject lines on our emails to increase the likelihood that we'll get them to be opened.
I love it. By the way, both Chip and Dan Heath were taught by Dr. Richard Thaler, who got the Nobel Prize for Economics for behavioral economics.
And the book was Nudge.
Well, and his other book called Misbehaving is better than Nudge. Big fan of that book. Another one that I would actually recommend a lot of folks is John Clifton's new book, Blind Spot. It's really talking about the happiness factors and really, that whole piece of what Gallup's working on from their perspective as well. So, we can get into a book club meeting all day long, but
after January 19th.
After January 19th. By the way, is your book going to be on Audible too? There's been more than one
Not until after it launches, Chuck.
Yep.
The initial launch won't have the Audible portion of it. And there's nothing to sign if you get the Audible. So
You can sign my screen.
yeah, yeah.
So, well, that's cool. It's been great because, one of the other areas that we're really starting to see a lot of integration and opportunities to knock down some of the silos is how wellness is starting to flow into things like DEI,
Yes.
ESG, sustainability, so many of those areas. How are you doing that, and where do you see the future of that for the wellness well-being professional?
Yeah, I mean, this goes right to what we just talked about, and that's being able to partner with everybody and anybody who's willing. Uh, and it also comes to like well-being literacy. Like, what does
Easy for you to say.
well-being mean? Yeah. But most leaders don't realize all the different things that contribute to well-being, and most departments don't realize that they play a role. So, Chuck, I mentioned employee resource groups previously. Our D&I department has sponsors employee resource groups. We help promote any and everything inside Johns Hopkins Medicine that's related to health and well-being. We partner with our organizational development and learning departments because they're our partners in creating these training programs for leaders at all level. Hey, can I give a shout out? I'm not gonna ask for permission.
Too late. You're already going to do it.
Well, there's a resource. It's free on YouTube that we created. It's called 10-Minute Wellbeing Tips for Managers. These are 10-minute video snippets. There's 46 of them. They were specifically designed for managers who are busy, and they help managers understand their role in supporting health and well-being on their team. And each episode is a different topic. If you don't like the topic, you skip that episode. And we completed the live series, and now we just decided to make the recordings available to everybody.
That's brilliant, Rich. And I'm actually going to be looking that up big time. And would it be okay? And again, I would love to get permission to make sure that this is okay. We would love to maybe even spotlight that on our NWI journal.
I think it's okay. Listen, I didn't even, so I'm not brilliant. What happened was we knew we wanted to record these, and our marketing communications department said sure, and we'll put them on a server. I'm like, fine. It wasn't until afterwards where I realized that the server that they're talking about is YouTube, so they're publicly available.
That's a big server.
Yeah,
that's for sure. So, hey, as we're starting to wind down today, give us your 1, 2, or 3 tips that you would love to have people take away today, other than tip number 4 is buy the book come January 19th. But what are some of the other tips that you would recommend kind of as people are going into 2023? What should they be looking at?
The first one I would, so listen, first I'm going to apologize to all of you. You're all seasoned professionals, and what I say may or may not be new to you. But the first one is what we've been saying, Chuck, and that is to partner with as many people as possible and share the same vocabulary. You gave an example about, well, just call it a safety program. And what I would say is, if there's a vocabulary that your organization's using, latch onto it. The second one is self-care. Remember, don't let your job in well-being or wellness stress you out, because that's really just not, not only is it not good for yourself, but the people around you will know it. And then you're not really doing your job by bringing your stress to the table. And then the third piece I would say is this is difficult work. And we all continue to learn. I mentioned earlier, I'm closer to the end of my career. I'm still learning. I hope you will continue to keep an open mind to learn what all of our colleagues in our community has to offer.
And, Rich, you said it so eloquently, because we do have to understand that not only is wellness a marathon, but it's a team sport.
Yeah.
And that's really the whole idea of what this is all about. What we want you, each and every one of you on this call today, for those who are listening to it from a recording perspective, we just want to make sure that people understand that there are folks out there like Rich, like many of you, that are willing and wanting to be there to help you. And it's a phone call, it's an email, it's not hard to get a hold of a lot of us, because that's what we want to do. And be honest with you, that those are the kind of things, and I'm sure it's the same with you, Rich, those are the things that really energize me after a very long and frustrating day of wellness.
Yeah. No, I mean, look, I'm at the point of I'm sorry I keep repeating this, but I'm at the point of my career where I do want to help.
Yeah.
And I do hope you'll read the book, not just because it's my book, but because it is a way of thinking. It is a tool that can serve as a conversation between you and your partners in your organization.
And I, again, even though he wasn't able to use it, I actually got to at least write a draft of a foreword for this book. So that tells you what I believe in this book. I don't do those kinds of things very often because, like I said, I go in with a lot of skepticism of these kind of of books, but there was nothing that I was so impressed with everything. So I definitely encourage you to pick up the book when you can as well.
So a cure for the common company. I have to thank my cousins and my siblings. We had a Zoom call during the height of the pandemic to brainstorm, and we came up with that play on the other phrase, which I won't mention.
I love it, especially this time of the season.
Oh, yeah.
Rich, thank you so much for your time today.
Chuck, great seeing you.
Thank you for being my first one in the new setup. January 11th is the next one. It will be with our good friend, Laura Putnam.
Oh, great. I'm going to be on her podcast.
Jump in, and I look forward to seeing many of you in January. If I don't hear from you beforehand, Happy New Year, Merry Christmas, Happy Holidays, and very excited about moving forward with this and with more conversations. Have a good day.